Hi everyone, my name is Megan. I'm doing my presentation for 5370 on a brief instrument to measure patients' overall satisfaction with primary care physicians. I don't want to butcher our lovely researchers' names, so there it is right there. And to get into it, these are the objectives. 1 and 2 are very similar, but they kind of touch on different points. You've got article takeaways and important facts to the articles. 3, you've got the article tie to the week's lecture notes. And 4, you've got the real life applications on the job. Okay, so the research methods, there were 535 participants between the ages of 18 and 75. There were 66% of those participants were females, but actually those weren't the key focus study group people within this chunk. Those who were over the age of 50 or 55 were the main ones who the researchers focused on or surveyed within this research article. And right here you can see that the participants were mailed a 10-item survey, and I'll get more into detail about that 10-item survey. And that survey was based, or is a patient satisfaction skills survey that the research developed based off of extensive review and research. The questionnaire was developed with minor modifications from the customer assessment of healthcare provider and systems through the Agency for Healthcare Research and Quality. They had 101 questions from the CHPS, where they got their 10 questions that focuses on patient satisfaction. And each question is on that 7-point Likert scale, where 1, they strongly agree, or 7, they strongly, or 1 strongly disagree, 7 strongly agree. I'll show you what the charts look like. So these are some of those charts. Here you can see that they focused on those who were over the age of 50. But really what that is just seeing how the survey was kind of divided and how they focused on different points of that survey. And here, if I go into the thing, you can see that the Jefferson scale of patient perceptions of physicians' empathy was a main focus within that. Results of the survey, or the article that they had within the survey, showed that they found their study to be limited because 1, they came from a single institution, so it was limited to their physicians, limited to their patients. They also limited themselves by really focusing on those in the geriatric age group and not focusing on anybody under that group. I kind of get into more detail about that further on. Ties to the lecture. Chapter 4. I specifically talk about Chapter 4 because Chapter 3 is voluntary healthcare insurance. And Chapter 4 is governmental sponsored health insurance. And most of our age group that the thing talks about, or that the article talks about, has those people in the elderly group where they don't really have voluntary health insurance. They need Medicare, or they need the PACE programs, or even those who may be veterans with the TRICARE for life. So there you've got the connection there. Then I did a further look and I went into the chapter 5, and that's where you really get your connection with the CAHPS and the HRQ, and then the satisfaction surveys with the Jefferson scale. And then right here is where like the meat of it is the real life application. With the patient satisfaction surveys, every hospital, clinic, and any kind of healthcare facility you go to, they're always going to send you that survey after your visit on how they did or how the facility looked or things like that. Looking at that patient-provider relationship that you had, or how your relationship was, or how they treated you, things like that. So this article may be out of date, being that it's in 2011, but they really hit key points. I think they really failed in that they focused on one group, and they could have expanded and focused on some other groups. But other than that, I think it's a really, really good article in the things that they covered, especially on how thorough some of these charts are. I think they could have expanded and done more questions. But I think the questions that they chose are very good. But I think their point that they made when they talk about that it is limited, but they recognize it, is good. But I think by one thing I say here, those who are living in poverty, those who don't have transportation, where are those relationships and where's the research on that? We may just not have it here, but I think those are some groups that need to be focused on and need to be touched on. Other than that, I think it's a good article. I think it has some good research. I think it has some good points. It talks about some stuff that we generally know, generally understand, being with the patient satisfaction and talking about those surveys and talking about those things that we generally understand and generally kind of have the point over. I just think it's missing a few key aspects and a few key things that they did hit on at the very end of their article. If you have any questions or any concerns of things that I may have missed, just reach out to me, let me know, and I'll be happy to answer anything you have for me. Thanks for listening.